Thank you for inviting me to speak here today. The IFPA feels that women's healthcare experience in Ireland when it comes to unplanned pregnancy falls far below Irish healthcare standards in all other areas, and indeed international healthcare standards. There are clinical risks to patient safety that are directly related to travelling for abortion or self-inducing abortion. We feel this is unacceptable and that provision must be made in law and policy for accessible, high-quality abortion services in Ireland. In order for this to happen, the 8th Amendment must be repealed. Women in Ireland do experience pregnancies that are unplanned, unwanted, or become a crisis because of a change in circumstances, whether that be social or medical. We don't know exactly how many Irish women have abortions. What we do know is that in 2015, 3,451 women gave Irish addresses when having abortions in UK clinics. We don't know how many gave other addresses or had abortions elsewhere. One online provider provided research in 2016 that 1,642 abortion pill packages had been sent to Ireland between the 1st of January 2010 and December 12. That's only one provider. So women are having abortion in Ireland, but abortion is excluded from mainstream healthcare. This is associated with weak systems which put women's health at risk. So the first problem is that the law locates abortion information provision outside mainline medical consultations and within pregnancy counselling. So while pregnancy counsellors are very good at their job, they go through options available to women, tease out the reason why their pregnancy may be a problem for them and try to help them coming to their decision. If they're presented with a medical issue in the middle of that, they don't feel competent to deal with that. Doctors generally would deal with issues regarding referral of women to other services that they need, but in this situation, they are forbidden from making direct referrals for abortion services, even where they are legal. And secondly, they will feel that because those services are outside of our state and outside of our control, that they may not have sufficient information about them to feel comfortable with referring women there. This moving of women into a different sphere without any proper referral pathway results in a loss of continuity of care. The impacts of travelling on women. Firstly, they actually make their decisions under far more pressure than they otherwise would. So most of the worry of the decision is around the financial implications, making the arrangements for the travelling, trying to find out the information about where the abortion clinic is, trying to find somebody to look after your children at home, maybe trying to arrange time off work, rather than just focusing on what is the best thing for me to do in this crisis pregnancy. The procedure they have is going to be decided based on the time they have to spend away. So somebody who has to come and go in one day is going to have a surgical procedure rather than a medical procedure. Globally, the trend is to encourage medical procedures because they have lower complication rates. Pain and bleeding are not necessarily severe. They're normal post-operative effects, but in Irish women, they're occurring in airports, on planes, in taxis, and on buses, rather than at home. If a problem does arise, they're unable to access follow-up care with the abortion provider because they're now back home in Ireland. And all of this tends to cause stigma, where women are made to feel like criminals. Travelling is not an option for everybody. In some cases, it's actually impossible. Somebody simply doesn't have the money or simply can't arrange the practicalities. Migrant women who can't get documents organised in time simply don't get the opportunity to travel. Women who don't have good English are still expected to make appointments by themselves without any assistance. Women with disability or minors are going to have difficulties travelling if they don't have a support person. And as simple a thing as living far away from an airport can be the extra thing that makes it impossible for women to access abortion. Not surprisingly, there is a growing trend of self-inducing abortion. The criminal laws do not deter women from seeking abortion, and women from all walks of life are increasingly accessing medication online to self-induce abortion. It's unacceptable that this clandestine self-use of medication is what they seem to feel is their best or maybe only option. And as a healthcare provider, we would not advocate accessing medication in this way in any other circumstance either. So what are the risks of self-inducing abortion? Number one would be that it is more likely to fail if, for example, the gestation has not been estimated accurately by the woman. So if she is in fact a week or two beyond what she thinks she is, it may be more likely that the abortion will not occur. Because some bleeding will frequently occur, she may actually think that it has occurred and only discover weeks later that the pregnancy is continuing. At this stage, her pregnancy has now been exposed to potentially harmful medication. Medication bought online is not always from a reliable source. It may not be genuine, it may be ineffective, or could potentially be harmful. Because the women know that they are breaking the law by taking this, they are fearful of seeking help when problems arise, and this causes, at the very least, anxiety and at worst, delayed management of complications. Some providers will provide support, but as this is by email, there may be several hours delay between a woman putting a question and getting a response. And nobody in the Irish health system is monitoring women's health outcomes in these situations. So what women need is a health systems approach where access to abortion is integrated into the reproductive healthcare system. How would you develop such a system? There are international health bodies who set standards for all areas of reproductive healthcare and the practice of obstetrics and gynecology. They rely on medical ethics, expertise, research, and up-to-date medical developments. The Royal College of Obstetrics and Gynecology in the UK, the World Health Organization, and the International Federation of Gynecologists and Obstetricians all have best practice guidelines on abortion provision. The World Health Organization suggests that we first should focus on reducing unintended pregnancy by ensuring access to contraception and sexuality education, ensure timely access to quality assured affordable abortion services when required, to be sure to meet the needs of disadvantaged women, and that administrative or procedural barriers should not be put in place to make it difficult for women to access services. And services should respect women's reproductive health rights, their dignity, their autonomy and equality. Looking to Europe, access is a big issue. If you ensure access to good quality services, you end up with lower, not higher abortion rates. Looking at other countries to see how they have developed practice, one example is Portugal, where the law was reformed 10 years ago, and a law and service provision model has been designed to ensure access to free early medical abortion. In this service, there's integrated contraceptive information, and this has also lowered their abortion rate in Portugal. So in conclusion, we would feel that the status quo is inequitable and unacceptable. Ireland cannot continue to accept an inherently weak system which is failing women. Access to abortion in Ireland is completely dependent on a woman's resources. Denial, therefore, disproportionately affects disadvantaged women. Unsurprisingly, human rights expert monitoring bodies have called for reform of Ireland's abortion laws, but law reform alone is insufficient to ensure access. Abortion services must be integrated into the reproductive healthcare system. As I've said, there is ample guidance and many useful models from other countries to fall back on to look for guidance in this respect. But repeal of the Eighth Amendment is the vital first step without which we can't do any of this. Thank you very much.